So fatigue is very common among all the autoimmune diseases. When you have an autoimmune disease, you're making inflammation against your own body. You can see it in the rash, like your psoriasis or the swelling of your joints, the psoriatic arthritis, and the stiffness and pain that you have. It also needs a lot of energy to create all that inflammation. And a lot of people develop some fatigue because they're in such an inflamed state. The other reason is when you have arthritis, it's a little harder to do everything. It's harder to open a water bottle, it's harder to walk upstairs, and you also have some chronic pain, and both of those things will be very tiring. And then another reason that you might have fatigue is that people who have arthritis, especially when it's not well controlled, can have difficulty sleeping. So at nighttime, they might be waking up or have difficulty finding a comfortable position, and that might be another reason that they're fatigued. When someone has fatigue, one of the main things we want to do is really control all the inflammation. So that means getting them on an effective medical regimen to reduce the inflammation to as close to zero as we can get it. The second thing is getting exercise can be very helpful. You move the joints around, which can be hugely helpful and help prevent some of the stiffness. And the third thing is really paying attention to sleep. So we really tell our patients to try to do some things to make sure that they're getting a good amount of sleep, even getting 8 to 9 hours a night. I would say 9 hours really seems optimal for a lot of our patients. They feel much better when they can get 9 hours of sleep. And then in terms of the quality of sleep, getting into a deeper sleep is very important. So again, when you exercise, you do tend to get into a deeper level of sleep. You can try to go to sleep at the same time every night and get up the same time every morning. Keep your sleeping space dark, cool, and quiet, and creating some buffer time. So that means a quiet time, a relaxing time before you get into bed. You can take a hot bath or have some herbal tea. The main thing, especially, is no screen time during that period of time. So turning off your phone, putting it in a drawer, so that when you get into bed, you're really ready to go to sleep. Now, for adults, another important thing can be really paying attention to the amount of caffeine and alcohol you have, and especially trying to reduce that around bedtime. As a doctor, we feel like it's our job to really help reduce the amount of inflammation that you have and to try to, as much as possible, get rid of all the inflammation. And that should help you in terms of improving your movement, improving any pain that you have. And generally that helps fatigue once you're able to move around more easily and you have less inflammation and less stiffness.